March 14th, 2023, 5:47 a.m. Eastern Standard Time. A convoy of black Chevrolet Suburbans rolls through the pre-dawn dark of North Dallas, Texas. Headlights off. Radios crackling with encrypted traffic. 14 federal agents from the FBI's Dallas field office and the Department of Health and Human Services Office of Inspector General are staged across 3 simultaneous entry points. Their target is not a drug lord, not a human trafficker, not an arms dealer. Their target is a hospice care company, a place designed, by law and by moral covenant, to comfort the dying. But here's the problem. The patients at this hospice were not dying. Many of them were not even sick. And the person running the operation? A respected figure in the local medical community. A churchgoer. A philanthropist. A man who shook hands with state legislators and spoke at healthcare conferences about the sacred duty of end-of-life care. His name would soon be read aloud in a federal courtroom, attached to a 47-count indictment. This is the story of one of the largest hospice fraud schemes ever prosecuted in the United States. $78 million. Stolen from Medicare. Stolen from taxpayers. Stolen from the very system built to protect Americans in their most vulnerable final days. And it was hiding in plain sight. To understand how this fraud worked, you first need to understand what hospice care is supposed to be. Medicare's hospice benefit was established in 1982 under the Tax Equity and Fiscal Responsibility Act. The premise was simple and humane. When a physician certifies that a patient has a terminal illness with a life expectancy of 6 months or less, Medicare covers comprehensive end-of-life services. Pain management, counseling, spiritual support, nursing visits, medical equipment, all of it. The patient pays nothing out of pocket. Medicare reimburses hospice providers a per diem rate, a daily payment for each enrolled patient. In 2023, that rate averaged between $160 and $1,400 per day, depending on the level of care. Routine home care, the most common category, paid roughly $200 per day per patient. Do the math. One patient enrolled for 6 months generates approximately $36,000 in Medicare reimbursements. Scale that to hundreds of patients, then thousands. The financial incentive is enormous, and the oversight for decades was catastrophically thin. Between 2010 and 2023, the number of Medicare certified hospice providers in the United States more than doubled. In Texas alone, hospice agencies proliferated at a rate that far outpaced population growth or increases in terminal illness diagnoses. Many of these new agencies were legitimate. Many were not. Federal investigators had been tracking anomalies in hospice billing data for years. Unusually long enrollment periods. Patients who were certified as terminal but never died within the expected window. Revocation rates. Cases where patients were discharged alive. That defied medical probability. The data pointed to a pattern. And that pattern led investigators to a cluster of hospice companies operating out of North Texas. The man at the center of the scheme had built his operation carefully over nearly a decade. He incorporated his first hospice company in 2014. By 2019, he controlled a network of 5 separate hospice entities, each registered under different names, each operating out of different office locations across the Dallas-Fort Worth metropolitan area. The corporate structure was deliberately fragmented. Billing flowed through separate tax identification numbers. Patient rosters were divided across entities to avoid triggering volume-based audit thresholds. On paper, each company appeared to be a modest, independent hospice provider. In reality, they were spokes on a single wheel. One man controlled every spoke. He recruited physicians willing to sign certifications of terminal illness for patients who did not meet the clinical criteria. In some cases, these physicians conducted no examination at all. They signed forms in bulk, stacks of them, delivered to their offices by couriers employed by the hospice network. Each signature unlocked a new stream of Medicare per diem payments. He recruited marketers, the industry calls them community liaisons, and paid them illegal kickbacks for every patient they brought in. These marketers canvassed low-income housing complexes, senior centers, churches, and assisted living facilities. They targeted elderly individuals, many of whom spoke limited English. They promised free medical equipment, free home visits from nurses, free medications. What they did not explain was that accepting these services meant being enrolled in hospice. It meant being classified in the federal healthcare system as terminally ill. It meant a physician somewhere had signed a document declaring they were expected to die within 6 months. Some of these patients were in their 50s. Some were ambulatory. Some were working part-time jobs. One patient, according to court documents, was enrolled in hospice care while simultaneously maintaining an active gym membership. They were not dying. They did not know they had been declared dying. The investigation formally designated Operation Comfort Fraud began in 2020, initiated by a joint task force of the FBI, HHS, and the Department of Justice's Civil Division. The first critical break came from a whistleblower. A former nurse employed by one of the 5 hospice entities filed a quitam complaint under the False Claims Act. She reported that she had been instructed to falsify patient assessments, to document symptoms that did not exist, to describe decline in patients who were stable, to avoid recording improvements in condition because improvements would trigger mandatory review and potential discharge. She described a culture of systematic deception. Nurses who refused to falsify records were reassigned or terminated. New hires were trained explicitly in how to document patient charts in language that would sustain hospice eligibility during audits. Federal agents obtained search warrants for all 5 hospice locations on September 12, 2022. What they found inside confirmed every element of the whistleblower's account and revealed dimensions of fraud that even investigators had not anticipated. They recovered 4,300 patient files spanning 7 years of operations. Forensic analysis of these files revealed that approximately 62% of enrolled patients did not meet the clinical criteria for hospice admission at the time of their enrollment. More than 800 patients had been enrolled for periods exceeding 12 months, doubled the expected terminal window. 981 patients had been continuously enrolled for more than 2 years. Agents seized 14 computers, 23 external hard drives, and over 7,000 pages of printed financial records. Digital forensic examination uncovered a parallel bookkeeping system maintained on encrypted spreadsheets. This shadow ledger documented kickback payments to referring physicians and patient recruiters. Payments ranged from $300 to $1,500 per patient referral. Over 6 years, kickback disbursements totaled more than $4.2 million. Bank records subpoenaed from 11 financial institutions traced the flow of Medicare reimbursements through a labyrinth of corporate accounts, personal accounts, and shell companies registered in Texas, Nevada, and Florida. Funds were used to purchase 3 residential properties, 2 commercial buildings, a fleet of 7 luxury vehicles, and significant cash withdrawals consistent with structuring. The deliberate division of transactions to avoid federal reporting thresholds. Total fraudulent billing submitted to Medicare across all 5 entities between 2014 and 2022 reached $78.4 million. Medicare paid out approximately $64 million of that amount before the scheme was disrupted. $64 million. Gone from the Medicare Trust Fund. Paid for care that was never needed. Paid for terminal diagnoses that were fabricated. Paid for a lie. The coordinated arrests took place on March 14, 2023. Federal agents executed 7 arrest warrants simultaneously across the Dallas-Fort Worth area, beginning at 6 Dole Am. The primary defendant was taken into custody at his residence in Frisco, Texas, a 6,200-square-foot home in a gated community. Purchased in 2020 for $1.3 million. Paid in cash. 6 co-defendants were arrested the same morning. 2 physicians who had signed fraudulent certifications of terminal illness. 1 office manager who had overseen the falsification of patient records. 2 marketers who had recruited ineligible patients in exchange for kickbacks. 1 accountant who had managed the network of shell companies and facilitated the movement of funds. The indictment, unsealed that afternoon in the Northern District of Texas, contained 47 counts. Conspiracy to commit healthcare fraud. healthcare fraud, conspiracy to pay and receive healthcare kickbacks in violation of the anti-kickback statute. Money laundering, aggravated identity theft for the use of patient identities in fraudulent billing. At a press conference held at the U.S. Attorney's Office in Dallas, the lead prosecutor stated that the case represented one of the most egregious abuses of the Medicare hospice benefit ever prosecuted in the Northern District. The special agent in charge of the FBI's Dallas field office described the defendants as individuals who exploited the most compassionate program in American healthcare for personal enrichment. The HHS Regional Inspector General called the case a stark reminder of the vulnerabilities in the hospice system and stated that federal oversight of hospice providers would be significantly expanded in the wake of the investigation. Behind the dollar figures, there were real people, elderly patients who discovered, some for the first time during the federal investigation, that they had been listed as terminally ill in Medicare's system. Patients who had unknowingly forfeited their right to curative treatment while enrolled in hospice, because Medicare's hospice benefit requires patients to waive standard medical coverage for their terminal diagnosis. One victim, an 82-year-old woman from Garland, Texas, provided an impact statement during pre-sentencing proceedings. She described receiving visits from hospice nurses she believed were simply providing free health checkups. She did not know she had been enrolled in hospice. She did not know a physician she had never met had signed a document saying she was dying of congestive heart failure. Her actual cardiologist later confirmed her condition was stable and well managed with medication. She told the court she felt violated. She said she did not understand how someone could look at her and decide to make money by calling her dead. Another victim, a 67-year-old man from Arlington, described being recruited at a community health fair. He was told he would receive free home nursing visits and medical supplies. He signed paperwork he did not fully understand. For 14 months, he was enrolled in hospice care. He was not terminally ill. During that 14-month period, he was diagnosed with an early-stage cancer unrelated to his hospice enrollment. Because he was in hospice, his access to standard Medicare covered oncology screenings had been disrupted. His diagnosis came later than it should have. His attorneys argued in a subsequent civil filing that the delay materially affected his treatment options. These are the costs that do not appear on any ledger. In January 2024, the primary defendant pleaded guilty to conspiracy to commit healthcare fraud and conspiracy to pay illegal kickbacks. Under federal sentencing guidelines and the terms of his plea agreement, he faced a maximum of 20 years in federal prison. The court imposed a sentence of 15 years, no possibility of parole in the federal system. He was ordered to pay $64 million in restitution to the Medicare program. The two co-defendant physicians received sentences of 8 and 6 years, respectively. The office manager received 4 years. The two marketers received sentences of 3 and 5 years. The accountant received 30 months. All 7 defendants were permanently excluded from participation in any federal healthcare program. Asset forfeiture proceedings recovered approximately $11, $3 million in real estate, vehicles, and seized financial accounts. The remaining $52.7 million in restitution is expected to be pursued through ongoing collection efforts, though federal officials acknowledged that full recovery is unlikely. This case is not an anomaly. It is a symptom. In fiscal year 2023, the Department of Justice recovered more than $2.68 billion in settlements and judgments from healthcare fraud cases. Hospice fraud has been identified by HHS as one of the fastest-growing categories of Medicare abuse in the country. Between 2019 and 2023, federal enforcement actions against fraudulent hospice providers increased by more than 300%. The Centers for Medicare and Medicaid Services has announced expanded audit protocols for hospice providers, including more frequent recertification reviews, unannounced site visits, and data-driven targeting of statistical outliers in patient enrollment, duration, and diagnosis patterns. But investigators and prosecutors will tell you the same thing. Enforcement is reactive. It comes after the money is gone, after the patients have been exploited, after the system has been bled. The hospice benefit exists because this country made a promise that when Americans reach the end of their lives, they will not face that passage alone, in pain or in financial ruin. It is among the most decent commitments a society can make. Every dollar stolen from that system is a dollar taken from someone who actually needed it. Every fraudulent enrollment is a bed, a nurse, a counselor diverted from a patient who was genuinely dying. And every scheme that goes undetected for years is a reminder that the guardrails around this promise are not strong enough. Not yet. Consider that the next time you hear someone describe healthcare fraud as a victimless crime, consider the 82-year-old woman from Garland who was told, without her knowledge, that she was dying. Consider the man from Arlington whose cancer screening came too late. Then consider that right now, today, there are hospice companies operating across this country that have never been audited. That there are patients enrolled in hospice who do not know it. That there are physicians signing certifications for people they have never examined. $78 million was the price tag on this one case, in this one city, over this one decade. The real number, the national number, the true scope of this fraud is something no one in federal law enforcement is willing to estimate on the record. Because the honest answer is that they do not yet know how deep it goes.